Insufficient funds. Insufficient funds.
I came across this fantastic new ad, which I think perfectly encapsulates the more recent frightening move towards the privatization of healthcare within Canada. Now, later on, I'll get to just how terrible the American healthcare system is, which for many Americans watching this is not going to be a surprise to you. But it's a message that I think Canadians need to really internalize before it's too late for our healthcare system. So this ad was put out by the Ontario Public Service Employees Union. Writing here, our lives are not for profit. That shouldn't be radical to say, but it's the message of our latest campaign, and the government of Ontario needs to hear it. Please share far and wide and take action. And I'll get to their website in a second here and what they break down there as well. Now, before I play this video, you're going to see there's some hyperbole in the ad, clearly, but I think it does perfectly give you the feeling of what private healthcare is, which it clearly does not center the patient. Check this out.
Want to get your wait time? Upgrade to a Fast Pass. Need a painless procedure? Pick your drug package now. Tired of waking up mid-surgery? Top up your anesthesia now. Insufficient funds. Insufficient funds. Insufficient funds. Insufficient funds. Insufficient funds. Insufficient funds.
All right. So as I said, I'm going to get to some details around the American healthcare system and just how terrible a for-profit healthcare system is. And I'll also get to some of the information that this website shares. But first here on this ad, I think the reason why I think it resonates so well is because of the atmosphere of it. Private healthcare is incredibly cold. It does not center the patient. Inherently, it does not center the patient. It centers profits. That's why it is for-profit healthcare. The whole goal is to make a profit and to ensure those profits grow every year. The complaints, the fear-mongering often around a public system is that, oh, there's rationing. There's rationing in a public healthcare system. There's rationing in all healthcare systems because there's not an unlimited amount of doctors, nurses, and hospitals. But the rationing in a public system is based on need, whereas the rationing in a private system is based on wealth. If you have no money, you die. In fact, several studies point to around 40,000 people a year die due to a lack of access to healthcare in the US. And I'll get to more data in a second on that here. But first, on their website, so because there is this scary move towards more, I've covered it in previous videos in terms of the Ontario government and Doug Ford, the premier, and their recent inroads into a more privatized healthcare system. You can look for those on my channel, or I'll link to some of them below this video in the description box under sources. But that's what, you know, this ad is based on, and they make some good points here. So they say private for-profit healthcare encourages predatory profit-seeking behavior by private clinics, worsens wait times and the staffing shortages by pulling resources out of the public system, which also goes to why a private public system also is not a good idea, because you're pulling resources away from the public system. Puts profit funds into shareholder pockets and increases out-of-pocket costs for patients and leads to medical debt. Medical debt is the number one kind of debt that exists in the US, is medical debt. Whereas it doesn't exist in public systems, in countries where there are public systems. Yet the number one kind of debt in the US is medical debt because of course, how insane that healthcare system is. They also write here, we can't let the Ontario government get away with destroying the public healthcare system. Ontarians rely on, especially when there are clear solutions, like increasing staff and funding in our public healthcare system and recruiting and retaining all classifications of healthcare professionals. So I've gone deeper into the Ontario healthcare system and the various criticisms of what Doug Ford is doing in previous videos, so I'm not going to retread all that information, but they have a good resource here. I'll link to this below as well. But let's just do a little analysis here of the American healthcare system with several sources I have here. So this from The Guardian. They write, a December 2019 poll conducted by Gallup found 25% of Americans say they or a family member have delayed medical treatment for a serious illness due to the costs of care. And an additional 8% report delaying medical treatment for less serious illnesses. A study conducted by the American Cancer Society in May 2019 found 56% of adults in America report having at least one medical financial hardship, and researchers warned the problem is likely to worsen unless action is taken. And yeah, this was 2019, before the pandemic. So all of the healthcare issues that have come up due to people having had COVID, and of course during the worst of the pandemic, made the entire situation here worse. And I'll get to some of that as well later on in a future tab here. But they also write, Dr. Robin Yebroff, lead author of the American Cancer Society study, said last month's Gallup poll finding that 25% of Americans were delaying care was consistent with numerous other studies documenting that many in the U.S. have trouble paying medical bills. Again, this does not exist under public systems, because why would people delay medical treatment due to cost when there are no direct costs associated? Now, there are other issues, especially in Canada, with the cost of certain prescription medications, and that continues to be a problem. That's even more of a problem in the U.S. when it comes to, I think on average, medication is about 10 times the cost in the U.S. compared to Canada, because we actually bargain down the cost of prescription drugs, whereas the U.S. oftentimes the pharmaceutical companies just set the prices and that's it. Like, just a ridiculous system. How could you be like, oh, well, you know what? Like, it, even under capitalism, like in terms of what people that love capitalism, what they see that the free market, that's going to bring down the costs and help consumers. Even under their world that doesn't really exist, to have just the cost out there and no one challenge it, be like, yeah, that's the cost of this drug. If you can't afford it, you die. It's just a ridiculous idea. Healthcare is a right. It needs to be a right, because you can't, anything can happen to you. Whether you get cancer, hit by a car, or even just, a normal illness can can trigger an underlying condition and make it worse. Everybody at some point is going to need serious healthcare, which is why it makes the most sense that everybody pays into the healthcare system, because at some point we all have to benefit from it. And when you have more resources going into that system, and there is no for-profit motive that is skimming money off the top, then all of that money is going into that healthcare system to help people, as opposed to, executives making billions of dollars off of your illnesses. Also here, this goes to the delaying of care. So this from Gallup, delayed care for serious medical condition due to costs by household income, which also shows you that disproportionately, of course, this hurts lower income people the most, with people making less than 40 grand a year being the most impacted in terms of delaying care due to a serious medical condition, or due to the cost. Now, also from Guardian here, despite millions of Americans delaying medical treatment due to cost, the U.S. still spends the most on healthcare of any developed nation in the world, while covering fewer people and achieving worse overall health outcomes. So they pay the most and get the least out of it. Unless, of course, you're incredibly wealthy, multi-millionaire, billionaire, doesn't really matter what the cost is, you're fine. But for most people, that is not the case. So, it's also important to point out that, yes, there can be Fantastic healthcare in the US. Fantastic. If you can't afford it. Does that make sense to base an entire healthcare system on it benefiting just the wealthy? There's just no logic to it. They go on to write here, a 2017 analysis found the U.S. ranks 24th globally in achieving health goals set by the UN. In 2018, $3.65 trillion was spent on healthcare in the U.S., and these costs are projected to grow at an annual rate of 5.5% over the next decade. And again, this was before the pandemic. So I'm sure it's gotten much worse. Scientific American here writes, a recent study quantified the severity of the impact of the pandemic on Americans who did not have access to health insurance, according to findings published in June 2022 in the Proceedings of the National Academy of Sciences USA. From the pandemic's beginning until mid-March 2022, universal health care could have saved more than 338,000 lives from COVID alone. The U.S. also could have saved $105.6 billion in healthcare costs associated with hospitalizations from the disease, on the top of the estimated $438 billion that could be saved in a non-pandemic year. So a public system, a Medicare for all system, would have not only saved countless more lives, it also would have saved a lot more money. Again, ask yourself, who is benefiting here? Last point from Scientific American. Prior to the pandemic, 28 million American adults were uninsured, and 9 million more lost their insurance as a result of unemployment because of COVID. How crazy is it to have your health care tied to your employer? And I discussed, of course, this quite a bit during the pandemic, when there were a lot of Americans that were losing their health insurance because of COVID, because they lost their job. And then what? Then they're screwed. They have to figure it. They have to figure out, where they're going to get their health care. Whether it's through, obviously Obamacare or getting a new job. Like there is this, all of this extra work that is needed, even apart from just how terrible a private healthcare system is. The fact that you have to think about this stuff, that you have to spend time out of your busy day arguing with insurance companies, ensuring you're covered for certain things, that alone is proof that this entire system is completely ridiculous. That you have to spend any time at all. As a Canadian, I do not have to think about health insurance because it's there if I need it. Meaning I don't spend any time at all trying to weigh certain options and, where should I get my health care now? Is this covered? This isn't covered? How can I afford this copay? I don't think about any of that stuff because we don't have that. But who knows? The way things are moving in Canada towards privatization, it's not hyperbole to think that it's possible we may experience that here at some point. Now, just read the quote here. Many Americans feel secure in having good health insurance from their employer, but employer-based insurance can be cut off when it is needed most. Not to mention, when it comes to unions not having to bargain for healthcare, if you have healthcare guaranteed to you, then that no longer is a bargaining chip. You get to have that guaranteed to you, and you can now focus your time and effort on other benefits, on wages, as opposed to fighting for just some basic healthcare. And again, I ask you, who benefits from this system? Health insurance companies make record profits as costs soar in the U.S. And this is a headline that you could print every single day of the year, because this is how the system works. Executives benefit. Wealthy people, generally, you could argue, doesn't really matter to them. You could say it benefits them, but it doesn't really when when your society is sick and poor. That said, it does benefit if you're incredibly greedy. All you care about is your own personal wealth. It benefits health insurance companies, and those are the top of those companies. And everyone else gets screwed. Again, I'll link to that ad below this video and all these other sources as well. under sources on YouTube in the description box. This is a message for both Canadians and Americans, because Canadians have to be aware of where things are going and the need to ensure you have political leaders who are not going to use our healthcare system as a bargaining chip for their corporate buddies, but also a message for Americans to realize, like, how much longer can you possibly take this terrible healthcare system? There has to be this greater push towards a public healthcare system. And I don't know. It's the way that corporate money owns politics, especially in the US. It's a tough battle. But you have to continue banging the drum, putting this message out there, because otherwise all hope is lost.